Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Craig Wilson, who is the Director of Health Policy at the Arkansas Center for Health Improvement and also leads ACHI's maternal and infant health related work. Craig, thanks for being here today.
Thank you for having me. I really appreciate talking about this important topic.
Well, we are talking about maternal and infant health today, and ACHI recently published a unique state-specific data and analysis in the maternal health space. So tell us a little bit about that and what did you find?
Well, we've been working on multiple different analyses really over about a year. We recognized interest in this topic, both from the standpoint of our tracking the number of hospitals that are still offering labor and delivery services. And we saw that about 4 hospitals had closed their maternity wards over the last several years. So we know that was going to be an emerging issue. And then separately, the federal administration, as well as the state administration, have invested some efforts in the space. And so as an organization with some unique data assets and turning that data into information that can inspire action, that's really what we hope to do with these multiple analyses. And they're wrapped in a framework of the birthing journey. And so we wanted to kind of bring everybody together within that birthing journey to move some policy forward.
And what was the time period for this, or is it still ongoing?
It's still ongoing. We have a number of different analyses from preconception to the end of the child's first life. And we thought that was really important to hit on all of those topics along the birthing journey and provide some analyses to inform some interventions to improve health outcomes for moms and babies here in Arkansas.
And so you found some startling statistics, right? Even though this is ongoing, there's still some really important data that you've found already.
Yeah, absolutely. We use our own data, but we also use some secondary data to really inform the public about what's going on. And one of the things I think that was really shocking to me was the rate of depression, both in the prenatal period for Arkansas women, as well as during pregnancy. We often hear about postpartum depression, but some of those figures were pretty shocking to me in that 1 in 4 women reported that they had depression in the prenatal period or during pregnancy. So I think it's important to kind of have the information available so that those interventions can happen throughout pregnancy. Another thing that was pretty shocking to me is that frequently secondary data reports teen pregnancy from ages 15 to 19. And when we looked at birth records, we saw that more than 100 teens, 15 and under, were having birth every year. And frequently, they were having a second child within 18 months. And so that's an intervention point that I think, where they're captured at the birth to have an intervention to have a discussion about what the potential is for a second birth and perhaps to stop that from happening.
And is this unique to Arkansas? Are you seeing it everywhere, or is it something that we're seeing that's a part of our culture here?
Well, I think that nationally, this has been a challenge. One of the statistics that brought this to surface was the maternal mortality rate. And in the U.S., we have double the maternal mortality rate of the next highest industrialized nation. It's double. And then in Arkansas, our maternal mortality rate is double that rate. And for Black women, it's double the state rate. Not unlike some mortality rates that you would see in third world countries. So that's a startling statistic. And while that's a small number of deaths, it's the absolute worst thing that can happen during the birthing journey. But it's just the tip of the iceberg, right? So we wanted to shed some light on what's going on under the surface and the risks throughout the birthing journey that may not lead to death, but it means that mom's not going home the same as she was before.
So with Arkansas having the highest maternity mortality rate in the nation, it really does make this place one of the riskiest to have a baby.
Yeah. Yeah, and that's unfortunate, there are multiple interventions that I think can occur, whether that's at delivery, earlier prenatal care, contraceptive availability, sex education, postpartum follow-up. There are multiple risks along the way, and for mostly white women, those risks involve mental health, particularly in the postpartum period. That's where you see the most deaths occur. For minorities, it's mostly cardiac conditions. So when we know these things are risks, you can pinpoint your interventions a lot better.
And our state also has the third highest infant mortality rate, and that's only behind Louisiana and Mississippi. Is that correct?
Yeah, and we thought that was very important in the birthing journey to couple, of course, the infant with the mother, because mainly the discussions have been around improving the outcomes for the mother. But if you forget about the child, you're doing yourself a disservice. And with that high infant mortality rate, we know there's some interventions from getting wellness visits early in the postpartum period for the infant, as well as some new kind of uh, different delivery models in the pediatric space to do kind of family level care. Normally, pediatrics is focused on the child. And sometimes you can also focus on the rest of the family, and there are new payment models that are allowing for that.
So tell us about the 9 points on a healthy birthing journey in Arkansas. What is that?
Yeah, it goes from preconception, right? Making sure that the mom is healthy, making sure that the birth or the conception is intentional, and once pregnant, making sure that prenatal care is there, making sure that the mom has education and supports, perhaps through, doulas, which are community-based support that assists them with navigation throughout the birthing journey, all the way to delivery, having the safest delivery that's possible. We saw that, C-section rates varied pretty drastically across the state. So making sure that those C-sections are medically necessary. And then in the postpartum period, making sure that even aside from the clinical aspects, the healthcare aspects, that that women and the rest of their families have available childcare assistance, and that it's affordable childcare assistance. Perhaps that they have some available maternity leave, because that's an important period. And then lastly, that they don't lose coverage in that postpartum period. And the coverage is not really the point. But when you disrupt care as a result of losing coverage, that's the critical piece. And for a new mom or a new dad during that period, your focus is on the baby. It's not really thinking about the coverage aspects. It's not really thinking about yourself. And we really need a better focus on the moms.
You touched on this a minute about C-section rates and what the study or the research is showing. Are you seeing a high rate of C-sections in Arkansas?
Well, relative to the nation as a whole, we're about the same on a statewide basis. Now, that's not to say that the C-section rate is still not too high. We know that there are contributing factors to that. The health of the mother can contribute to that. We have high obesity rates, which contribute to C-sections. Pregestational diabetes and hypertension both contribute to that. So our overall rate still needs to come down to meet what are called the healthy 2030 goals, and we've got a ways to go on that. I think the interesting thing that we found was that there was a threefold difference in C-section rates depending on where you lived, and we dug into that a little deeper, and we know that there are some differentials in the health of the population, which make a difference there, as you would expect. But there are also practice patterns by providers that contribute to that. So when we controlled for everything related to the mother that could contribute to a C-section, there were still differentials in practice patterns. So I think there's some potential for some education with hospitals and their physicians and the delivering providers that can be done to improve that rate.
So who is delivering babies in Arkansas? What are you seeing?
Yeah, that was one of the main questions that nobody had an eye into. And that's one of the things that we like to do. We can say, look, we have the data here and we can show you what's going on there. And there are about 350 delivering providers across the state. The majority of whom are physicians. We do have, about 30 to 35 nurse midwives that are delivering babies here in Arkansas, and some lay midwives that are delivering kind of outside the clinical system. But the overwhelming majority are physicians. And among those physicians, the overwhelming majority are OBGYNs. So one of the goals within the workforce supply is to diversify the number and type of delivering providers that we have, so that we're not as heavily reliant upon OBGYNs, because really in a lot of our rural areas, there are not OBGYNs available. Most women are probably going to their family practice doc if they're going to a doctor at all. And so shedding some light on that we thought was really important. Another thing with respect to the providers themselves is there's not a lot of diversity in terms of their race and ethnicity. And we know that makes a difference from a cultural standpoint, and it can improve outcomes when you see a provider and have a provider that looks and talks like you. And so while that's going to take a lot longer to change because the pipeline is so long particularly for physicians, some effort needs to be there, mind you, but we think that doulas can offer that in the short term, some cultural sensitivity to help a woman along the way in the birthing journey.
And there's also a major issue with travel time to delivery facilities. You mentioned closures of labor and delivery services in Arkansas hospitals in recent years have led to longer travel times for many mothers.
Mm-hmm. Yeah. So we saw that about in 2022, I believe was the year that we looked at, about 1 in 10 mothers had to drive more than 60 minutes across the state. And the standard for specialty care generally for network adequacy is 60 minutes. So when you've got that many women who have to drive further, it can lead to complications with the delivery. I mean, you've got people delivering on the side of the road, and complications for the baby too. One of the things that we wanted to shed a light on is what happens when a hospital closes its birthing unit. And we looked at Helena and Magnolia, and for both of those hospitals, the median travel time went from single digits to 40 or 50 minutes for those women. And that's the median travel time. So half of those mothers were driving even further than that. And so that impact is very acute on the people within a city and within a county, not just for the health of the mother and the baby, but for the experience, right? It's an anxiety causing event, although it's a wonderful event in your life. But to imagine having to drive that far and potentially not be within your own community and around your family, that can cause much more anxiety and is deleterious for the experience itself.
Well, the birthing journey really serves as a foundation to hang data points and policy options to improve maternal and health outcomes in our state, not just ours, but other stakeholders too, right?
Right. And we have about 4 of our staff on a number of the governor's working groups, which was the governor's working groups were established earlier this year. They are in the development of multiple different recommendations in the clinical space, in access to care space, in outreach and education, and in data collection, which is, one of the things that we like to focus on as well. So we expect some recommendations to to be finalized and published in the fall. We've been contributing to those, contributing our information to help develop those as well. And I see some promise in some of the things that are coming out of these work groups.
Well, Craig, I appreciate you being on today and talking about this important work. And I have no doubt that your work and research will shape the future for Arkansas mothers. I appreciate you. Thank you.
Thank you so much.
And that's it for AFMC TV. Have a great day, and thanks for watching.